To bring in Senator Lambert.
Thank you very much for your presentations here this morning. I suppose the disadvantage that we are, other than the chairperson, none of us are qualified medical practitioners, so we have to rely on advice given to us by medical practitioners. And one of the documents I have here before me is a document from the Infectious Diseases Society of Ireland, signed off on by 28 consultants. So they've given us a presentation here, and maybe if I quote one or two issues from it, and you might like to comment on it. And I suppose this is the disadvantage that we are here, is that we have this document here signed off on by 28 different people. And I'll give you some of the quotes from the document. In 2016, the Swiss Infectious Disease Society of the Swiss Society for Neurology combined to produce evidence-based guidelines for the management of post-treatment Lyme disease syndrome. And just a quote from that report says, growing and unequivocal evidence confirms that prolonged or repeated antibiotic therapy for PTLDS is not beneficial, potentially harmful. So that's one of the issues that they've said in their submission to us. And another quote from it is, chronic, and this is a quote from the document itself, chronic Lyme disease is usually a diagnosis that a patient with chronic symptoms of pain, fatigue and difficulty in thinking acquires in the absence of another explanation for their symptoms. There are many patients with a variety of real and troubling chronic symptoms, including fatigue, weakness, and they name a number of other medical terms, symptoms, who believe they have a chronic form of Lyme disease. Although these patients are truly unwell and some significantly disabled, symptoms are not specific and overlap significantly with those of other medically unexplained symptoms complexes such as chronic fatigue syndrome or fibromyalgia. There is no evidence to support occult Lyme infection as the cause of these symptoms. Most will have multiple serial negative Lyme antibiotic tests in the setting of very long-term symptoms. And they go on to suggest that there is no convincing evidence to suggest that Lyme disease represents either a marker of immune deficiency or leads to impaired immunity. And basically they outline to us in this document, I suppose, that yes, there is an acceptance that patients have symptoms, but not all of these symptoms are what you would come in under the category of Lyme disease. And I'm just wondering, here we have a report presented to us by the Infectious Diseases Society of Ireland, signed off by 28 consultants, which seems to vary with the presentations being made this morning. And I suppose our problem is, as a committee, we're not medical experts. We're not here. It's very difficult for us to, I suppose, come to a conclusion when we have contradictory evidence being produced to us. So I'm just wondering, maybe you might like to comment on that.
I'm a member of IDSI. I've never seen this. Okay, so of note. So part of the challenge is, I've told you this huge polarity that exists. Let's go back to the ICD-11 codes that talk about chronic persistent Lyme that have been approved by the WHO. What was submitted, but what was submitted were hundreds of articles showing that Lyme persists. They call it post-treatment Lyme disease. It's not post-treatment, it's ongoing infection. There's hundreds of articles that have been submitted to the WHO and reviewed for them that showed that Lyme persists, even after people get 2 weeks of antibiotics, 4 weeks of antibiotics. There's animal studies, rhesus monkey studies, that you treat them with 2 months of IV antibiotics and then you sacrifice them at the end of it. You can still grow Lyme. So the treatments, this is not post-treatment, this is ongoing infection, you see. So none of those studies have been included in these IDSI documents. So I agree with you. They've come up with this opinion signed off by 28 clinicians in Ireland. But why is it then that you have an opposing international organization, the WHO, that's had all of the science put together and presented, and they've come up with a different conclusion. I guess I'm just saying is that you're right. It's very confusing to you when you've got one group saying this and another group saying something else. We're not saying every case of fibromyalgia is caused by Lyme disease, okay? However, there's lots of, I would think that if you're in Donegal and you have fibromyalgia and you were previously well and you get a flu and a fever, you should entertain the diagnosis of Lyme. And you know, I'm just telling you, we're missing lots of cases of Lyme. So I've never seen this. I'd love to read it, and I'd love to review it, and have the opportunity to do that. And I'd also love to have the opportunity to be in a public forum where these things are discussed. So I think there's new science that's come along. The IDSI publications, I saw something coming along there back in December, but never received a chance to review it, never a chance to discuss it, never a chance to present the WHO data to them, which they've obviously excluded. So I would say this is an outdated document, and it's not reflects the
Sorry,
current science.
this document for this committee this morning.
I'm not disagreeing, but I'm saying so then we should get the people that made that document to say, are you aware of the ICD-11 codes? Are you aware of the WHO document? I'm sure they're not.
But they're quoting from a 2016 Swiss Infectious Disease Society detailed analysis of this issue. So are you saying that report produced by the Swiss authorities is incorrect?
Right. I've not seen that. So that's the thing. So I'm saying, but it's the same. The evidence base is that we go back to the 2006 IDSA document on treatment of Lyme guidelines. I'm saying that we keep on going back to the same, you know, poor science as far as I'm concerned. There's new recommendations from the WHO. There's 800 articles that are out there that show persistence of Lyme, chronic Lyme, and I would want to make sure that all of those scientific articles are included in this publication.
And could I just say something? I mean, the 28 consultants have come together. They've come up with the Cancers Agreement. That it must be very difficult, as you said, for people from a non-medical background, because these are seen as the experts. They're saying there's no convincing evidence. There is convincing evidence. They have either not read it or they're refusing to read it. So are the 28 consultants who signed that document saying that the World Health Organization is wrong?
But in fairness, they are quoting from quite a number of reports, and they're relying on quite a number of research documents in preparing this report, because they give us references to those documents. So all I'm saying is, we're here. We have 28 people who have given us their and I suppose what they're concerned about is that prolonged treatment, and this is coming up time and time again in this submission, prolonged treatment can lead to other medical difficulties, and they have
the same doctors who are giving prolonged treatment for, you know, bone infections, outpatient antibiotics for 6 weeks, 12 weeks, 6 months. So in one situation, for chronic Lyme, it's dangerous to give antibiotics, but for other infections, it's not dangerous. The best way to resolve this is if I was able to respond to these documents and had an open forum to discuss them, I can actually provide you with data that actually updates this document. This document I've never seen. So I think the best way forward is to actually not have people meeting in a room signing off that our way is right or my way is right. We really do need to have transparency and not this kind of Chinese whispers approach to science, which I think is currently the situation for Lyme.
No, I think
for other diseases, you know.
I think I'm the only member of the committee that was here 3 years ago where this issue was dealt with. Mm-hmm. And, you know, the same issues that were brought up at that meeting are coming up this morning. And what I'm saying is that we don't seem to have made any advances in the last 3 years.
We have
No,
the
we have
WHO,
the World Health Organization.
and every other country. Apparently, almost all the countries are now coming on board to change their view and to look at the new science.
But isn't it then a matter for you as the professional here to deal with the Infectious Diseases Society of Ireland, in the sense that their view seems to be of a different in some respect to your view.
But the view should support the science, not support the opinion. And I would like to actually review the report, because very often what happens is people cherry pick and choose what they want for this. And I'm just saying, I've done my homework and done a comprehensive review, and there's a lot more to when you actually look into these documents than meets the eye. So I just think there has to be more transparency and better science and some kind of a dialogue with the groups who are involved in Lyme to come up with a fair and scientific consensus that actually represents, you know, the understanding, the new understanding we have of Lyme that we didn't have a couple of years ago. I'm not sure if those documents actually have that knowledge. Dr.
Lambert, I'm just going to bring in Nikki St. George Smith.
I just actually, with the greatest respect, I would love to address what you said. I am a patient, I'm in remission, and I was bitten in 2000. I had a bullseye rash, I was tested, I was diagnosed with Lyme disease, and I was given 10 days doxycycline. I took my antibiotics and never thought about it again. But I continued to have low-grade pain and low-grade issues, health issues, until I developed Parkinson's-like symptoms in my late 20s and early 30s, Alzheimer's-like symptoms, and I became unable to read. I found speaking very difficult, and I couldn't really, I found it very difficult to walk. I had no energy. I was in constant pain everywhere in my spine, all over my body, all of that. I couldn't work. I was an aid worker. I made documentaries, and I couldn't do that anymore. And then it was brought to my attention that I may actually still have an infection. I was the biggest skeptic and cynic when it came to this. I thought, that is crazy talk. This doesn't exist. It cannot remain in your system. That is ridiculous. But with no other option, and it was literally the last idea on the list of possibilities, I went and got retested, excuse me, and I tested positive. So after 15 years, the infection remained in my body, and I went and had treatment, and I made a full recovery. And I have gone back to work, and I'm currently making a documentary on Lyme disease in a global context. We are talking to the people who are involved in the latest research on Lyme, on Borrelia, on these tick-borne co-infections, on vector-borne infections. And we are talking to the people who signed off on what you have in front of you should be listening to. Science is we are with science. Science is not with us. We are with science. And science does not deny this. Science would deny what those people have signed off on. And the thing is, it's coming. Change is coming. You know, it will trickle down. But we have a choice whether we say, like Minister McSharry said, or Deputy McSharry said, that we can be pioneers. We can be ahead of this and we can contain it. Or we can be late to the party and watch as the world changes eventually. And we are still dinosaurs. I would ask that, as you have said, Doctor, that there is open discussion here, and we bring in some of these experts to address these people, because they don't have this information, or they're choosing not to.
Sorry, in fairness, they were brought in 3 years ago.
No, I'm talking about Dr. Eva Safi, who is the world's leading expert on biofilms and on Borrelia, and this is the kind of thing that we're going to be talking about going forward, and we're talking about why testing isn't accurate, and all of these. These are the things that we need to talk about, and why we're not being listened to and being treated as though this isn't happening. You know, I mean, this is really important. We need to get them in here.